October is National Breast Cancer Awareness Month. 1 in every 8 women in the U.S. will be diagnosed with breast cancer in their lifetime. Medical lifestyle expert Dr. Eudene Harry tells us preventative care as well as signs for women to look for in detecting breast cancer.
So we want to combine prevention and early detection. There is, happily so, a lot of early detection in the news, and so we want to start at the age of 40 to get annual mammograms. And that is something that you discuss with your doctor. So it could be your family physician or your gynecologist. You discuss what is a good schedule for you to do. If you have a strong family history of breast cancer, I would recommend that you start earlier than that. Again, a conversation that you have with your gynecologist as to what time is appropriate. Breast self-exams are really important. You know your breast better than anyone else, even your family physician. So once a month, do a self-breast exam. There's some great things online on how to do that. Important points, do it at the same time of each month because your breast does change throughout the month. So if you're picking a time after your period, maybe a week or two, stick with that time schedule. If you notice something that's abnormal, concerning, and I would underline concerning, please speak to your physician about this because, of course, you and I know that women younger than 40 have developed breast cancer. And early detection is important because survival with early detection is great.
Now on to preventative care. Dr. Harry has 2 tips to preventing breast cancer.
Well, there have been some studies done on breast cancer and nutrition, and it seems there's a link to reduce occurrence of breast cancer when we eat a more plant-based diet. And by that I mean including your fruits and vegetables, primarily vegetables, and cruciferous vegetables are really important in this category. And by that I mean Brussels sprouts and cabbage and broccoli. Those are things that most of us do like to eat, we don't like to prepare, but it's easy to know that you can do these relatively easily. Also, foods that are high in beta-carotene have also been shown to be linked with a reduced occurrence of breast cancer. And so by that, the brightly colored orange fruits and vegetables, so you're looking at carrots and you're looking at sweet potatoes, all things that we like to eat. Reduce saturated fats in your diet because that has been linked with an increased risk of breast cancer. So it's primarily all the things that we know about eating healthy really applies to breast cancer.
The second tip requires women to move their bodies.
Exercise has actually been linked to reduce occurrence of breast cancer as well. And we're thinking, even though we don't know the exact mechanisms, we're thinking it's because it helps us to metabolize things a little bit better. And it helps us, of course, to manage our estrogen levels a little bit better. And it helps us to keep those fat cells down a little bit better. And fat cells are really active cells, and so they can actually be hormonally active and create some imbalance there as well. So when you link those 2 things together, we're thinking heart and brain, add breast to that as well.
For more on how to prevent breast cancer or schedule a consultation with Dr. Harry, head on over to drharrymd.com. I'm Miriam Tapia for the CW South Florida.